More than 100,000 people cross the border daily through San Diego and Tijuana, and the cities exchange more than $4 billion a year. President Trump has floated closing the border to address the unprecedented number of families applying for asylum in the U.S.
We're going to have a strong border, or we're going to have a closed border.
President Trump subsequently backed off, giving Mexico a year to solve the crisis, or else. Threats to close the border are scaring people here. San Diego's hotels rely on workers from Tijuana. Americans who can't afford San Diego housing live in Tijuana while commuting to work. Wealthier Mexicans send their kids to private school in San Diego. And San Diegans who can't afford health care in the U.S. go to doctors in Tijuana, such as Bertha Guerrero, who lives in San Diego but has a dentist in Tijuana.
And I came here because it's cheaper in Tijuana than in San Diego, no?
Guerrero is seeing a dentist at the first Mexican HMO to be licensed as a healthcare provider by the state of California. SIMSA offers medical and dental services to Americans. But in Tijuana, President Frank Carrillo says dozens of people canceled their appointments this week because Trump's threats to close the border made them afraid they'd get stuck in Mexico if they crossed.
Just the threats alone, just that in itself is already creating a problem. People don't want to make a trip.
Carrillo says the HMO employs about 500 physicians and treats between 1,500 and 2,000 patients a day. He says closing the border would be devastating, not only for his business, but for most of the people he knows.
We're dividing families by doing this. So really nobody wins in this situation. Nobody wins.
Many local residents live as if the region were a single place.
San Diego and Tijuana are really one metropolitan area, even though there's a border between us that separate us geographically and politically and all this stuff. We are one community.
Lucila Conde works at a San Diego nonprofit that installs solar panels for low-income families.
Hi, this is Lucy at Grid Alternatives. How can I help you today?
But she has a house in Tijuana and cares for sick relatives over there.
We have commitments and relationships on both sides. I have a family member who is on dialysis in Mexico, and she requires help and attention.
Every morning, dozens of new asylum seekers arrive at the port of entry to put their names on a wait list. It takes weeks to be called to speak to a U.S. Customs officer because of the long backlog. Most are from southern Mexico and Central America. Some come from other areas. One woman who's been waiting since last month is from Cuba.
If they close the border, I don't know what's going to happen to us.
She asked for anonymity because she fears for her life.
When a human leaves her country, her culture, her habits and roots, it's because she must. Because the saddest thing in the world is be a migrant. People humiliate you. They mistreat you.
Back at the medical practice, Carrillo says that as much as he fears for his business, he fears for asylum seekers too.
These people are fleeing poverty and violence. So the answer to this problem is go to the root of the problem. The root of the problem is there.
He says the U.S. should help people in Central America. But President Trump recently announced plans to end all aid to Guatemala, Honduras, and El Salvador as punishment for failing to stem the tide of migrants. Jean Guerrero, KPBS News.